Introduce yourself and verify the client's identity. Explain the procedure to the client and provide privacy. So this is to gain cooperation and lessen the anxiety of the client. And then perform hand hygiene and observe appropriate infection. So this is to minimize the contamination. So the client's eyes should be closed whenever possible. Testing should always be bilateral. So this is to provide baseline assessment. So for the light touch sensation, ask the client to close her eyes and let her respond yes or no or now when she feels the cotton wisp touching her skin. With the cotton wisp, lightly touch one specific spot and then the same spot on the other side of the body. Ask the client to point the spot where the touch was felt. So for the pain sensation, ask the client to close her eyes and let her respond sharp or dull or don't know when she feels the sharp or dull end of the safety pin or needle is felt. Alternately, use the sharp and dull end of the sterile pin or needle to lightly prick the hand, forearm, abdomen, lower leg, and foot. Do not test the face. Allow at least 2 seconds between each test. So for the kinesthetic sensation, ask the client to close his eyes, grasp the client's middle finger or big toe by the sides and move it up and down. Have the client tell you orientation of the middle finger or big toe. So for the cranial nerve assessment, olfactory, the cranial nerve tests sense of smell on each nostril separately. Have the client occlude a nostril and use various scent. Repeat with the other nostril. So this is to test the function of the olfactory nerve. So for the optic, check the client's visual acuity using the Snellen chart. If the client uses eyeglasses or contact lens, let him wear it. Test visual fields. Let the client follow your fingers coming into the visual field from all directions. So this is to test and inspect the optic nerve. So for the optic and oculomotor, check papillary reaction to light in both eyes. So this is to evaluate the cranial nerve. So for the oculomotor trochlear and abducens, ask the client to follow your finger as you trace an edge in midair. So this is to check the oculomotor, trochlear, and abducens nerve function. And then for the trigeminal, ask the client to clench his jaw, feel for strength and bulk of the temporalis and masseter muscles. So this is to evaluate the trigeminal nerve function. So for the facial, ask the client to raise his eyebrows, to close eyes tightly, puff of cheeks, smile, frown, and show teeth. So this is to test the facial nerve function. So for the vestibulocochlear, test hearing by whispering a word or holding a ticking wrist watch into each ear. So do the Rini and Weber test as well to test the vestibulocochlear nerve function. So for the glossopharyngeal emphasis, assess and listen to the client's voice. Have the client drink a glass of water. Check if the uvula is midline. Have the client say ah. Observe if the soft palate rises evenly. And then check the gag reflex. So drinking a glass of water will provide an accurate findings and to test the glossopharyngeal and vagus nerves function. So for the accessory, have the client turn his head against a resistance and to shrug his shoulder against a resistance. For the hypoglossal, observe the client's tongue for any atrophy or fasciculation. Have the client stick out his tongue and check if it protrudes midline. Have the client press his tongue on the inside of the cheeks. And then document the findings in the client record using the form of checklist supplemented by the narrative notes when appropriate. So this is for the references and baseline data.